Ladies and gentlemen, FAPA delegates, good day to you. I'm Dr. Navin Kumar Loganadan, a practicing clinical pharmacist in the area of diabetes at Endocrine Institute, Putrajaya Hospital, Malaysia. I'm glad to share my research entitled Pharmacists Virtual Consultations for Diabetes Patients in Malaysia, Impact on Medication Adherence and Glycemic Control. The prevalence of diabetes in Malaysia keeps increasing, where it currently stands at 18.3%, whereby 1 in 5 Malaysians are diabetic. Their glycemic control, however, is suboptimal, with only 34.4% of patients in primary care and 12.2% of patients in the hospital attaining the target HbA1c of less than 6.5%. This has led to the increasing rate of diabetes complications, particularly the end-stage kidney disease and dialysis. About one-third of the treated diabetes patients reported hypoglycemia according to the HEAD study, which cost the Ministry of Health about 4,000 ringgit Malaysia. Diabetes Medication Therapy Adherence Clinic, or DMTAC, is a pharmacist-led clinic in Ministry of Health where pharmacists actually help diabetes patients improve medication adherence and glycemic control. In between the doctor follow-ups, the patients actually see the pharmacist as opposed to standard care. Talking about telepharmacy service, the earliest use of telepharmacy service dates back to 2000s, whereby pharmacists in central regions in the United States were allowed to receive, check and verify prescriptions received via telephone from remote locations. During the COVID-19 pandemic, pharmacists in many countries, including Malaysia, have utilized telepharmacy services to continue providing pharmaceutical care for diabetes patients. In this study, we aim to evaluate the outcome of pharmacist-led virtual DMTAC consultations for diabetes patients. This is a prospective multi-center study involving 17 hospitals in Ministry of Health with the main outcomes of medication adherence, glycemic control, and hypoglycemia. Patients who had type 2 diabetes diagnosis with a minimum of 1 year physical follow-up in DMTAC and had telephone were included, whereby patients who had poor phone connections, not able to allocate time for virtual consultations, had noisy environment and language barrier were excluded from the study. Data was analyzed statistically using the SPSS version 26.0, and these are the results. The median age of patients enrolled in this study was 58 years old. Majority of them were of Malay race, followed by Chinese, and they had a duration of DMTAC follow-up for at least 1 year, which amounted to at least 3 physical DMTAC visits prior to the enrollment in the study. Most of them received the basal bolus insulin therapy as the antidiabetic regimen, followed by oral only. And among the oral agents, metformin was the mostly used antidiabetic agent, followed by the DPP-4 inhibitor. Patients had a poor medication adherence at baseline, indicated by a MyMart score of 51, and also a poor glycemic control, indicated by an HbA1c of 9.2%. Among the most common pharmaceutical care issues identified during the virtual DMTAC consultations were poor medication adherence, poor medication knowledge, poor self-monitoring of blood glucose readings, and inability to do a proper insulin dosage adjustment. A scoping review of medication adherence of diabetes patients in Malaysia have already reported low medication adherence rate among these patients, as reflected in our study. Looking at how long the virtual consultations were provided, the median duration of virtual consultations was about 20 minutes. This is actually shorter than the usual average of 30 minutes spent during the physical visits. The virtual DMTAC consultations has improved access of diabetes patients to pharmacist care, particularly during the COVID-19 pandemic, whereby patient visits to the hospitals were restricted by the government. And this is similar to the telepharmacy services in other parts of the world. And how about the response of patients during the virtual consultations? Majority of them showed a very good response, almost 90% of them. And this is probably because they did not actually had to travel out of their homes, and this correlated with improved satisfaction with telepharmacy services that was previously reported. And looking at one of the important outcome of this study, the medication adherence, it is interesting to note the medication adherence of diabetes patients improved significantly from a MyMart score of 51 to 54 after the 6 months virtual DMTAC consultations. And their medication knowledge of the patients also improved, whereby majority of them showed good medication knowledge at the end of follow-up. And this improved medication adherence is consistent with previously reported studies, whereby improved medication adherence of 95% to 99% have been reported in telepharmacy services for coronary heart disease patients in the United States. And the another important outcome of this study, which is glycemic control, HbA1c, has shown a significant improvement after the virtual consultations, a reduction of 1.3% from 9.2%, reaching 7.9% at the end of 6 months. And this is inconsistent with the this is in accordance with the systematic review of 14 telepharmacy services for diabetes patients from 2011 to 2021, which showed that HbA1c reductions ranging from 0.2 to 2.1%. Another meta-analysis of 23 studies have also showed a significant decrease in HbA1c of about 1.3% with telepharmacy services. What about hypoglycemia incidence? At the end of the 6 months virtual consultations, majority of the patients who actually had hypoglycemia at baseline had their hypoglycemia resolved. And this is also in accordance with the meta-analysis of 23 telepharmacy services from inception to 2021, which showed a reduced risk of hypoglycemia with a relative risk of 0.48 for diabetes patients. And another thing that the pharmacist did during the virtual consultations was also to adjust the insulin doses, and the outcome of insulin dosage adjustment were mostly moderate. This was also probably because the inability to actually physically view the glucose readings, because it's all via the telephone. And however, this is also inconsistent with the positive outcomes reported on insulin dose titration by telephone. Previously, in a study whereby the telepharmacy group achieved a mean A1C reduction of 1.1% as opposed to 0.8% in the primary care group. Of course, this study is not without its limitations. Of course, doing a virtual consultations or telepharmacy consultation, there are technical problems like phone connections, poor phone connections, and noisy background. And if the patients are elderly, they may have had hearing problems, which actually may have introduced bias in the outcome assessment, and also time constraint to provide the phone services, whereby it's all depending on how long the patient and the provider can spend time for this session. And also the pharmacists were also not able to review the injection site and technique as opposed to the physical visits. And also they also had inability to physically view the SFBG readings that they could do with the physical visits. In conclusion, the virtual consultations by DMTech pharmacists has resulted in improved medication adherence and glycemic control in Malaysian type 2 diabetes patients. This approach should be adopted to complement the physical DMTech follow-ups, which would ensure a sustained pharmaceutical care delivery, especially for patients who have trouble physically coming to the hospital or the clinics. Addressing technical issues and providing support to patients who require assistance, in particularly the elderly patients, would increase the efficiency of DMTech telepharmacy services in Malaysia. Thank you.